Hello, my name is Mia Cifuentes. Today we'll be talking about Tooth Wisdom, which is a program that focuses on promoting good oral health. Today we're going to talk about why oral health is important, oral health conditions older adults commonly face, and visiting dental professionals. I've just passed out a quiz that we will be doing together at the end of the workshop. Please hold on to it. Let's get started. We now know improved ways to keep our mouths healthy. Contrary to what you might think, losing your teeth is not a natural part of aging. Many of you are keeping your teeth longer, so we want to equip you with some oral healthy tips and tools to continue to keep your teeth for a long time. There may be some challenges that make it harder for some people, such as older adults, to maintain good oral health. What are some challenges you face or that you can think of? Some of these challenges are taking many medications that can contribute to dry mouth and tooth decay, soft diets that can lead to tooth decay and limited finances, believing that dental visits are not needed, lack of transportation to the dental office for care, and, as we age, dental pain is not felt as readily. So by the time one is in dental pain, oftentimes the disease is far more advanced and difficult to treat. Not having a good oral routine plus these challenges increase your risk of poor oral health. The health of your teeth and mouth affect the rest of your body. The mouth is the gateway to your body, so issues with your oral health may lead to problems in your overall health. For example, poor oral health can increase blood sugar levels in diabetics, seriousness of heart disease, risk of stroke, risk of aspiration, pneumonia, risk of infections in other parts of the body. Oftentimes, a dental professional is the first one to suspect if their patient has a particular systemic condition or illness, well before being diagnosed by a doctor. Signs of bleeding gums or increased tooth decay may indicate there are other health issues going on in the body. If you have diabetes or any other chronic diseases, be mindful that you may be at a higher risk of mouth problems like mouth sores, yeast infections, gum disease, tooth loss, burning mouth, and dry mouth. However, as long as you keep a clean mouth, free of tooth decay and gum disease, these health issues can be controlled and maintained. If you have all of your teeth, a few teeth, or no teeth, there are oral health problems to keep in mind and be aware of. These are some oral health problems you can have. Today we'll quickly talk about cavities, sometimes called dental caries, root caries, also called root decay, gum diseases, sometimes called periodontal diseases, oral cancer, cancer that develops at any part of the mouth. Bacteria in our mouth and the sugar we eat combine to create acid. This acid creates cavities, which is the structural damage of the tooth that causes holes. Every time we eat food or drinks with sugar, acid is created. The more sugary the food or drinks, the more acid is created. These acid attacks increase your risk for cavities. Root decay or root caries are when the bacteria and sugar acid attacks the root of the tooth. Age is a risk factor because your gums tend to recede, exposing the root surface of the tooth. With the root exposed and because there is no enamel of the root, it is easier for the acid to reach it. Dry mouth can also cause root decay because there is a lack of saliva to wash away the bacteria on the surfaces. Dry mouth may have a side effect on certain medications. It's important to see your dentist if you feel pain, have an unusual smell in your mouth, or feel swelling on your gums. A side note on dry mouth. Did you know that there are more than 400 medicines that can cause dry mouth? If you have dry mouth, you are not alone. Many people take these medications for diabetes, heart disease, stroke, and depression. What's the best way to relieve the problem of dry mouth? Sipping tap water is a healthy way to feel better. Some people like to use a straw to sip their water. Most tap water contains fluoride, which helps to strengthen teeth. Most bottled water does not contain fluoride. Avoid sucking on cough drops or hard candy because they are made of sugar, but it's fine to use sugarless candy or drops if you like them. There are also over-the-counter products available in form of gum, mints, lozenges toothpaste, rinses, and sprays. These products also contain xylitol that neutralizes the acids in your mouth, helping to combat tooth decay. Discuss these products with your dental professional. They also recommend and prescribe other products as well. Gum disease is caused by bacteria in the plaque of your teeth. Gum problems can loosen your teeth and eventually result in tooth loss. There are 2 types of gum disease. Gingivitis forms on the upper layer of the gum and is the first stage of gum disease. It can be reversed with good daily care and regular professional cleaning. These cleanings involve removing plaque, the soft film of the gum line of teeth. If the plaque is not removed, tartar forms, which is a hard substance that can be removed by a dental professional. Tartar causes inflammation or infection, which leads to periodontitis, the next stage of gum disease that forms deeper in the gum layers and surrounding bone. Treatment will stop if it's getting worse, but will not bring your gums back to normal. The treatment for periodontitis is also good daily care and regular professional cleaning. To stop gum disease early, see your dental professional if your gums bleed when you brush, you have red, swollen gums, your teeth are looking longer, or if you have loose teeth. All of these are not normal. Oral cancer is most common in older adults over 60 years of age. Your risk increases if you smoke cigarettes or cigars, or if you use smokeless tobacco, you drinking alcohol in combination with tobacco use on a regular basis, you stay out in the sun without sunscreen or other protection. When oral cancer is detected early, you can expect a good outcome. In later stages of the disease, treatment is difficult and there can be problems. It's important to know the symptoms of oral cancer. See your dental professional if there have been changes in the floor of the mouth, roof of the mouth, cheeks, lips, tongue, back of the throat, such as red or white patches that don't heal within 2 weeks, or a patch that gets larger over 2 weeks. You trouble chewing? You feel the lump in your throat? Your dentures start to feel tight or does not fit comfortably. Dental professionals are key to good oral health. See your dental professional if you don't have any teeth or don't sense any problems with your teeth, mouth, or dentures. Go for routine visits and cleanings. When visiting a dental office, there are some things we want you to talk to your dental professional about. Be sure to share any changes in your overall health history with your dental professional. Sometimes we don't think about telling our dental professional about a recent knee surgery or heart attack, for instance. But remember, we mentioned before about our oral health affects the rest of our body's health. Tell them if you have a heart disease, diabetes, high blood pressure, or have had a stroke. Ask your dental professional the recommendation on how often you should schedule dental visits. The most commonly recommendation is every 6 months, but some are suggested more frequent office visits and sometimes are as frequent as every 3 to 4 months. Provide a list of your medications with how often you take them and their dosages. These medications could be affecting your oral health condition or affect any type of treatment that is planned on your visit. We'd like to recap the reasons to visit your dental professional. For a routine checkup, again, you don't only go when you have a problem. It's important to visit regularly to ensure that there is no current or future issues. If you have pain or discomfort, bleeding gums, sore or spot that hasn't gone away in 2 weeks, if you're having problems chewing, swallowing, and eating, if you notice to have a dry mouth, check if your dentures are not fitting properly. Many events may occur at your dental visit that you should be aware of. A visit to a dental professional may also include checks for oral cancer and other problems that are best treated early. Your dental visits usually include examining your teeth, gums, tongue, and the inside of your mouth, x-rays to check for cavities, professional cleaning, and if you have partial or full dentures, the dental professional will make sure that they fit well and are comfortable for you. It's time to wrap up. What are some things you have learned today that you can do to have a healthy mouth? Thank you for your time today.